Hi there, I'm Austin Burlage from Freedom Physical Therapy in Brookfield, here to demonstrate a couple different sleeping positions and kind of give you the benefits and drawbacks of each different position and why one might work for you and one might not. We'll start with the side-lying sleeping position. So throughout a night of sleep, people will adopt different postures, whether it's side-lying or sleeping on your back or sleeping on your stomach. Most people will spend the majority of their night on their side, which is a really good position because it's going to keep the spine and the pelvis in a really neutral position, so it should cause some pain relief there. So here's the side-lying sleeping position. And one thing we like to tell patients is to use a pillow between your legs, because if you don't, sometimes you can roll a little bit and cause a little bit of twisting. And so we want that spine to stay nice and steady. So we'll put a pillow between the legs here. And then you're just like that. And that causes a nice stable spine, stable pelvis right like that. It'll take some of the pressure off of your spine, for one. For two, it can help relieve some symptoms of acid reflux disease, especially if you're sitting on your left side, or sleeping on your left side, excuse me. And it can be helpful too for women that are pregnant, because when you're pregnant you have really lax ligaments, you really need a lot of stability, so you want to make sure everything's staying in neutral. This position can be aggravating for people that have hip or shoulder injuries, because you end up rolling on top of it. So sometimes it's a position you might want to avoid if you're having a lot of problems with those structures. But for the most part, if you're having back pain, this is going to be the position that you want.